Hi, everybody. Dr. Chris Peterson from Pere Smiles here. Just want to talk a little bit about tongue ties for medical professionals, and we're mostly gearing this toward infants. So, we've been seeing a lot of infants in our office for tongue tie and lip tie and cheek tie releases to aid with breastfeeding or bottle feeding. And then we do other ages too, but we have a lactation consultant in the office that we see a ton of infants, and we try to help out young families that are struggling with feeding issues. So, let's jump in right away. And I want to start with, why would you watch this video? Well, like I said, this is for medical professionals. And if you've had parents come in or moms like this with their little one, and they are just at their wits' end because their baby won't feed well, or they're colicky or gassy or fussy, and maybe it's even painful for mom to breastfeed her baby. And they look you in the eye and they say, "Hey, is my baby tongue tied?" And you don't really maybe know what to say or how to look or what questions to ask, or even if there is a tongue tie, who can fix it and how can it be done well? So if that's you, we're here to help you. If you've ever done an exam on a baby like this, there is a much better way, and we're going to show you how to do that today. And then if you think dental lasers are for Star Wars or they're just dangerous things like lightsabers, we're going to teach you why dental lasers are the best tool in the world for this procedure. Not all dental lasers are created equal, but we'll tell you why a CO2 laser is the best. So just really quickly, a little bit about me. I'm a Wisconsin native. I grew up in Marinette, and then I went to St. Norbert College for undergrad. I met the love of my life there, and we got married right after undergrad. We took a little 4-year journey out to Pittsburgh, and this is actually my first day of dental school in Pittsburgh. I can't believe how young I look. I look like a baby. So then after 4 years there, we moved back to Wisconsin, and I did a 1-year residency. I was 6 months in Milwaukee at the VA hospital doing a ton of oral surgery. So that was awesome. And then I did 6 months in the Green Bay, the new VA clinic there, doing general dentistry, and learned a ton. It was kind of a springboard for my dental career. So that was a great experience. And that brought us to West De Pere, where we purchased De Pere Smiles, and it's been a lot of fun ever since. It's a heck of a journey, being a business owner and a dentist at the same time, but it's been a lot of fun, and that's where we're at right now. So why am I doing this? Why is a guy like me talking about, infants and tongue ties and breastfeeding and bottle feeding and that sort of thing? Well, I got sucked into this because this is my family right here. This is my wife and my 3 kids, and our oldest daughter. We brought her home from the hospital, and had the goal of breastfeeding, and it just wasn't going that well for my wife. It was maybe a little bit painful for her, and then the last thing that happened was our daughter was just really, really gassy and fussy, and every time we laid her down in her crib, she just was like in pain. And my wife said, "Something's wrong. Like, I just know this is not right." And we're first time parents. We had no idea what to expect. And so we had a lactation consultant come out to our house, and right away she said, I'm suspicious for a tongue tie. And I kind of looked at my wife and I thought, I'm a dentist. The mouth is my wheelhouse. I should know about these things. I had zero training whatsoever in residency, dental school, anything about tongue ties in infants, especially. So, the more we looked into it, we had a tongue tie release done on our daughter when she was an infant. And that was done with a local provider with scissors, and things worked out really well. And so I naturally wanted to learn more. So long story short, I went out to Boston, I went out to Arizona, went to Portland, got some really awesome training on infants and frenectomies and lasers and that sort of thing. And we started doing releases here in 2017, and it's been unbelievable to see how we've grown from that point. We're still growing. So it's a lot of fun just educating young families when they walk in the door, because tongue tie is kind of a controversial thing. The parents say, "Yeah, I've asked my pediatrician or I've asked my lactation consultant about it," and maybe one of them said, "Yes, there's a tongue tie." One of them said, "I wouldn't worry about it," but they're having all these issues and they want answers. So they find us, and they walk in our door, and they're at their wits' end. And you guys know exactly what I'm talking about. And we're just here to help and to educate the parents about, hopefully it's just a quick fix, and hopefully we can rule out a tongue or a lip tie and make sure that it's not that. But if we can't, let's fix it. So that's why we're doing it. It's just a big passion of mine because I've been there personally. My wife and I have been through it, and it's not easy. So we're just here to help. So what do I want you guys to take away today? Just a couple things. What exactly is a tongue tie? When do we call it a tongue tie? When do we not? So we'll go over that. How to screen for a tongue or lip tie, super easy. I'll show you a video of myself doing an exam. And then who can fix a tongue tie if there is one, tongue or lip tie, and how do they do it? So we'll talk a little bit about that. I'll show you a video of a procedure that we did. And then at the end, hopefully you learned all this great stuff and you're all fired up. Well, what are the next steps? We're going to talk about that at the end. So first off, what is a frenum or a frenulum? I always tell parents that everyone in the world has a little strand of tissue underneath the tongue that covers muscle attachments, and it's right there. So hopefully you guys all know what that is and what that's called, but if you don't, it's called a frenum. So what is a tongue tie? It's a frenum that causes a functional restriction. That is absolutely critical. If it doesn't cause a problem, we just call it a frenum, okay? And it doesn't matter what the appearance is. Like this one right here, it looks pretty bad. It's really close to the tip of the tongue. So I always say appearance, if it's poor, it usually leads to poor function, but not always. This could be a very high functioning baby. And I always say we're not going to fix something just because it looks bad, especially in a baby. That's key for parents to know. We're pretty conservative in that respect. So it's all about function for us. So what made this a tongue tie? Because it is a tongue tie. Well, mom came in, brought the baby in, and she reported these symptoms. The baby had a shallow latch during feeding. That led to it being painful for mom to breastfeed her baby. There were clicking noises during feeding, which tells us that there's a poor suction when baby latches. And that led to excess spit up, because when baby has a poor latch, they a lot of times take in a lot of air, which leads to spit up, and then hiccups and colicky baby. So that was what was reported by mom. During the exam, what we saw was there was milk tongue, we call that, where there's a white coating on the baby's tongue. And that just means that the tongue is not self-cleansing like it should be. It doesn't rub against the breast and elevate properly to rub that white milk off and stay pink. So we saw that. We saw that the baby had a high roof of the mouth or palate, and that's the shape of the roof of the mouth is totally dictated by tongue movement. So if the tongue is restricted in that upward movement, we a lot of times see a high narrow palate, which can lead to orthodontic issues or breathing issues in the future. So we saw that. We saw that baby had a hypersensitive gag reflex, because if baby's not used to a proper deep latch and mom's nipple getting all the way back on the roof of the mouth like it should be, every time something goes back there, like my finger, when I have baby suck on my finger, they're going to gag. So we want them to desensitize that over time by having a proper deep latch. And then you can even see it right on this picture. There was a limitation in elevation of the tongue. The sides of the tongue go up, and right in the middle there, it's like a V or a heart shape, we call that. So that's restriction in elevation. So we actually did a tongue tie release on this baby. And 1 week after release, we had mom come back in for follow-up like we always do, just to check on healing and make sure they're doing a good job with stretches. And this is what she filled out, the same exact form that we had her fill out before. And the only thing on there that she had was hiccups. And that was only once in a while, not during or after every feed like she had reported before. There was a deeper latch. It was not painful for mom to breastfeed. There was no clicking noises. The baby was not spitting up, and they were a lot more content. So that's amazing. At 1 week, that's what she reported. On the exam, we did not see a milk tongue anymore, so the tongue was able to cleanse itself. The roof of the mouth, that's going to take some time to fix that. So that was still high. We're talking months or years to get where we want to get with the shape of the upper jaw. And then the gag reflex was better, and the tongue was not limited in that upward movement. So at 1 week after release, we saw all those improvements, and that's why we're doing this, because we're able to change lives. We're able to save breastfeeding relationships for parents, or even help with bottle feeding. And it just takes a lot of stress off the parents. If they can't feed their baby, they feel like failures, and it's sad, but that's kind of where they're at. So that's why we're doing it, because we're seeing all these amazing results. So the next thing I want to jump into is how to screen. Okay, so if someone walks in, like I said, and they said, "Is my baby tongue-tied?" And I just want to let you know there's two things that you got to do. You got to ask the right questions, and we're going to tell you what those are. And then you got to do a proper exam. So we'll show you that. So it's super easy. This is our questionnaire that we hand out to all parents when they come in, or they actually fill it out ahead of time before they come in. And right here are the symptoms for the infant and for the mother if they're breastfeeding. If mom's not breastfeeding, if they're bottle feeding, we're not going to have any symptoms over here, which is great. And then just the infant symptoms. We can still have a ton of infant symptoms if we are bottle feeding. So yeah, it goes through all these lists of things. And if you have your parents fill this out and there's 10 things on this list that they check off, well, that warrants a proper exam, in my opinion. So here's how to do a proper exam. So what you'll see here is I'm sitting there and I have baby, I go knee to knee with the mom, is what we call it, a knee to knee exam. And we just have baby lay on both of our laps. And that's perfect because the parent can hold the baby's hands down or legs if they're a little bit crazy. And then I can just kind of hold the head, and you'll see a video in a second here. But nothing fancy. You can tell I got gloves on. I got a light, which is great. If you don't have a light on your head, that's okay. You can still do a good exam. But then I also have magnification on my glasses. So if you don't have that, that's fine too. But all you need is 2 chairs and a pair of gloves. That's really it. So let's show you, well, in a second, I'll show you that video. But here's our exam form that we fill out during the exam that we do, the intraoral exam. And that just kind of goes through some warning signs that we're looking for. If babies are not latching properly, we're going to see, blisters on baby's upper lip and or lower lip, and milk tongues on here, the shape of the palate, how the finger suction was when we have babies suck on our finger. If it's all over the place, we like to document that just so we know where we started. So that's the exam form, and you guys are going to have access to this at the end of this video. So let's watch a video. So I'm coming from over top of the baby's head, which is absolutely critical. I like to say, if you are face to face with a baby and you're trying to lift up the tongue or the upper lip, just to look for a tongue tie or lip tie, it's just not easy to do. So when you're pulling things toward yourself, it's so much easier to see what that upper lip flexibility is and what the tongue flexibility is, because you can isolate those frenums, and you're going to see that here in a second. Let's see here. So you'll see right here, I elevate that upper lip. I try to cover the nostrils as kind of my benchmark that I try to accomplish. And if I notice any tightness or white tissue, we call that blanching right here, then there's limitation in movement. You can feel it when you elevate that upper lip. And if there's tightness there, I always tell parents it's easy to visualize how much more movement we're going to have of that upper lip so they can flange out during feeding if we do a release. So that's easy to see for the parents. Then we keep going here. I'm going to pull the baby gently to the right, looking for any cheek ties, gently to the left, looking for another cheek tie. And then I'll get underneath the tongue. And right here, you can notice I'm getting my fingers underneath the tongue and really elevating it, and that really isolates that frenum right here. So this is a classic Eiffel Tower appearance, we call it, and it's an anterior tongue tie because that frenum inserts into the bottom of the tongue really close to the tip of the tongue. Kind of tough to see from here, but you can see how limiting this tissue is right in this spot, because the sides of the tongue go up, the center is just held down, and it's like a V shape in that tongue. So you can tell it's really easy to see and feel what you're doing if you have that proper positioning and you just get in there. You're not going to hurt these babies by lifting up that tongue like that. And you can see what you need to see. And then what I'll do after this is I'll look for, I'll feel the roof of the mouth and just feel the shape of that so we can record if it's high and narrow, which a lot of times we see. So what can parents expect at our office when they make an appointment? Let's just walk through that. The first thing, like I said, they're at their wits' end a lot of times, and they just want to be heard. They just want to let someone know that they are frustrated with where they're at, and they've been told about 3 or 4 different things about tongue ties from different people. So we just want to listen to them. That's important. The next thing, we talk to the mom or the dad or both about the infant and mother symptoms that we're having, like we had on that sheet. And then we'll do a feeding assessment. So this is Jenny, our lactation consultant, and this is actually our lactation room that we have. So Jenny will spend a half an hour with the babies before I even walk in the room, and she'll do the feeding assessment and just kind of get the history. And then she'll weigh the baby just to see what they took in during the feeding, breastfeeding or bottle feeding. And then what will happen is I'll come in the room, I'll educate the parents about a few things, and then we'll do that exam like we talked about. And education is everything here at this office, whether you're coming in as a dental patient or as a young parent with a baby. We like to educate people. Like I said, that's everything. We want to just make sure that they're not confused about tongue tie, and that we just simplify things. We talk about the mechanics of breastfeeding and bottle feeding, the tongue movement for the baby and how it potentially is limited and that sort of thing. So we just pride ourselves in that. And then the procedure, if necessary, if we recommend a procedure, that will literally take less than 5 minutes. So we definitely have time to do that same day. So speaking of the procedure, I'm going to play a video in a second here. And this is just, you'll notice a few things. This is a grooved director that I get underneath baby's tongue and lift that tongue up. This is the laser that we use, and there's no contact or cutting or burning. It's just a laser beam that's shot at the tissue, and it vaporizes this tissue, usually without any bleeding, which really helps us see what we're doing. And then this is just a little suction. So let's do it. So my main job during a frenectomy, I always tell parents, is I want to take away the excess tissue in front of muscle attachments so that the muscles can actually work properly and they're not held down by excess tissue. So you'll see that I can see what I'm doing right in there. I just vaporize tissue, watch it peel away, and I can, if I don't have any bleeding, I can really see where I'm going and where my stopping point is, because I don't want to go too deep into the muscles, because that's where nerves and blood vessels live, and I don't want to touch those. And I don't want to go too shallow. I want to make sure I get a full release and allow those muscles to work properly. So that's really important. That's why we use the tool that we do. All right, guys. Well, hopefully you learned a little bit about tongue and lip ties today, how to look for them properly. And then if you're suspicious about something, how to get that patient or that family to a provider that can help them. Here at Pere Smiles, we make it as easy as possible for you. We don't need an actual referral from you. We just need a phone call from a parent. So all you got to do is give them our information. And we're more than happy to send brochures or business cards your way if that's easier for you. But yeah, they make a phone call to the office, and then we just take everything from there. So super easy. Another thing I want to talk about is something that I think is really cool. I've been all over the country learning and getting some good hands-on experience from some amazing providers when it comes to infants and lip and tongue ties. I'm trying to share that opportunity with you guys. So we've had providers here in the area come and hang out with us for a whole day or for a half a day or for just an appointment for a baby. And what happens is that's how you're able to learn, because you're going to watch us do an exam on a baby, and then you're going to do the exam too if it's okay with the parents, and usually it is. So that's the best way to learn, in my opinion. We'd love to have you in the office. All you have to do for that opportunity is just email lactation@thepuresmiles.com, and then we'll set that up and we'll get something on the schedule. Very last thing I'm going to talk about is our mission here is to help as many people as we possibly can. So if you can do us a favor and just share this video with someone that you think would learn a little bit or it will be beneficial for, please do that. And that's how we spread the word. That's how we help as many people as possible. So that's where I'm going to leave it. Thank you so much for watching. I really appreciate it. And if you got any questions about anything, just let me know. Thanks.